So today I am going to speak on stroke. Stroke is a medical emergency. Stroke, there are two types of stroke. The number one is ischemic stroke, in which the blood in the brain get clot in the blood vessel, because of which oxygen in the brain don't reach. Second is a hemorrhagic stroke, in which the blood vessel in the brain get ruptured and the blood comes out in the brain tissue, leading to the weakness. So time is brain. Any patient developing symptoms suggestive of stroke, like weakness in one part of the body, tingling sensation in one half of the body, slurring, difficulty or speaking, difficulty in vision, difficulty in hearing, imbalance, should immediately reach the hospital, as time guides the treatment of the stroke. Any patient coming to the hospital within 4.5 hours and having ischemic stroke are eligible for ischemic therapy, that is a clot buster. In such patient, we give an injection which is a strong clot buster, which can dissolve the clot in the brain and can re-establish the blood flow, resolving the symptoms of the stroke. So anyone having the stroke symptoms should not ignore and rush to the hospital. Anyone developing the signs and symptoms of the stroke should not ignore. They should immediately reach the hospital. They should contact the hospital nearby, the hospital which is managing the stroke patients. So once the patient reaches the hospital, now this emergency starts, the urgency starts for the hospital people. So any patient coming to the hospital emergency with the sign symptom of stroke, they are given the priority. Why it's being priority? Because the timeline guides the treatment of the stroke. Anyone reaches the hospital within 4.5 hours of the onset of the sign symptom of the stroke are eligible for therapy, which is a clot buster, which resolves the bleed in the clot in the brain, the occlusion of the blood vessel in the brain, and relieving the symptoms of the stroke and resolving the symptoms of the stroke. So here timeline guides. Any patient coming to the hospital, we have a timeline and guideline of doing the CT scan immediately. The time of the CT scan from the onset of the patient coming to the hospital is within 25 minutes. So any patient coming to a hospital within 25 minutes, the CT has to be done. It is known as a door to CT time. The second, the patient coming, CT is done, and the CT scan shows that it is ischemic stroke and the patient is eligible for thrombolysis, then he should undergo the starting of thrombolysis within 1 hour. So it is known as door to needle time. So the door to needle time should be within 1 hour. So following this guideline, the examination part has to be completed in between, the eligibility has to be checked within this time. Patient started with thrombolysis gives a good result. So subsequently, if the patient is started on thrombolysis with complete monitoring, we do the thrombolysis, and subsequently after thrombolysis we shift to our neuro unit, as we are having a dedicated stroke neuro unit. So we shift the patient for better monitoring in that neuro unit and keep them there for 1 or 2 days, with subsequent, depending upon the recovery, we shift them outside the neuro unit. So finally, I, Dr. Vineet Kumar Todi, consultant neurologist, Apollo International Hospital, will like to say that time is brain. Anyone developing signs and symptoms of stroke, like slurring of speech, weakness, imbalance while walking, or any sensory symptom like tingling, should not ignore those signs and symptoms and should immediately rush to the hospital. 4.5 hours timeline is a golden period. You can save your life without ignoring the signs and symptoms and reaching to the hospital.